Tommy is taken to the hospital by ambulance and is rushed into the treatment room. The medical team gathers around to assess his injuries. Tommy is restrained on a backboard with a cervical collar in place. Tommy is conscious but disoriented. He asks to see his parents, who have not yet arrived. Tommy's injuries include a lacerated liver, an open fracture of his left femur, a concussion, and multiple scrapes and bruises. He cannot see what is going on and becomes anxious when he hears the commotion around him. He begins to panic when he realizes that his clothes are gone and when he feels the sting of the IV.
Hi, Tommy. My name's Carol. I'm your nurse. You're in the hospital. You're going to feel something tight on your arm. We're going to give you some medicine to help take the pain away. We're going to explain things to you before we do them so you don't have to be worried or afraid, okay? I'll tell you everything that's going to happen. We talked to your mom and dad, and they're going to be here shortly. They're going to be with you in a few minutes, okay? As soon as they get here, we'll let them come in to be with you. If you have any questions about anything, you can ask me, and I'll explain them to you, okay?
Tommy is having some understandable reactions to the trauma. He's scared and anxious. Many children will feel especially anxious if their parents or caregivers are not present. Like Tommy, children in this situation will look to another adult to provide needed comfort and reassurance. During a trauma, help children understand what is happening and why. Without information, they often use their imaginations to fill in the gaps. Sometimes they imagine something worse than what is happening. For example, thinking, being at the hospital means I'm going to die. Children can also misunderstand common medical procedures, such as thinking that the IV is taking their blood away, which can make them even more worried or scared. When children get emergency procedures, describe what is happening, particularly the sensations they may experience. Use simple, clear terms like, you'll feel a tight band on your arm, or we're cleaning your hand with a cool cloth, or we have to take off your shirt, pants to see where you are hurt, but we will cover you up.
Try to sit up.
Descriptive information not only orients a child, but can also build their trust and confidence in you while decreasing their fear of the unknown. Even with this information, remember that children might be overly scared or worried. Be sure to provide emotional reassurance along with realistic information.
Hi, Tommy. I know you may be worried right now, but I'm going to stay here with you the whole time, and I'll explain things to you as they're going on. We had to cut your clothes off so that we could see where you were hurt so we could help the pain to go away. And that's where we're putting some ice on right now. There's some medicine going into your arm, and that's going to help your leg to feel better and take that pain away. We have a gown on you now to keep you covered, but if you get cool, let me know and I can give you more blankets. We have you all covered up. Right now, there's a bunch of us that are in here trying to help you, and so someone's touching your knee, your arm, and putting ice on your leg. That's 8 hands all together that are over here helping you, trying to make you feel better.